Welcome to Microbiome Lab's Clinical Grand Rounds. I'm Dr. Nicole Berkins, and for today's session, we have Dr. Jocelyn Strand here to discuss the gut-lung axis with us. This is a topic that's more relevant than ever before as we continue through this current pandemic. So I'm really excited that she was able to take the time to share this information with us today. Let me tell you a little bit about her. Dr. Strand graduated from Bastyr University in 2005 with a doctorate in naturopathic medicine. Following her graduation, she established her practice in the Seattle area, working at Pharmaca Integrative Pharmacy, as well as in a gastrointestinal specialty clinic. She had a private practice at Lake Superior Natural Medicine, where she specialized in GI system disorders, Lyme disease, and autoimmune conditions as a primary care provider. In 2019, Dr. Strand became the Director of Clinical Education for Bio-Botanical Research Incorporated. She enjoys sharing useful clinical information based on research and her own personal experience at all of the talks that she gives at events around the world, which, as we were just talking about, are more like around Zoom nowadays, but
so true.
Dr. Strand, welcome. Thanks so much for being here.
Thank you so much for having me, Dr. Berkins. It's really great to be here.
So I'd love to start by having you share about your work with Bio-Botanical Research. You obviously were a clinician, a practicing physician in primary care practice, had your own clinic, but then you made this transition to being Director of Clinical Ed for Bio-Botanical. Talk about how that came about.
Okay, I'd love to. And this is of all of the products that I didn't learn about in medical school that I wish I'd learned about, this is the one I wish I'd learned about the most. And really what happened for me is that once I got acquainted to the clinical efficacy or with the product and watched it do its work, I knew that I wanted to help other practitioners learn about this product and how to use it. And what happened for me is, I think it was maybe 8 years ago now, I had a patient who was a little girl, 3 years old. It was like a failure to thrive, basically, but she also had, and this is pertinent for today's conversation, so I decided, I actually talk about her almost all the time because it really isn't my introduction to the product line. But what happened for her, what used to happen for her was that she would eat, and then she would have, shortly after, and intermittently, so not every time, she would have a respiratory response that was asthmatic. She would turn blue, pass out, but it was all silent. So her mom would walk in the room and she'd be passed out on the floor. Her mom was convinced she wasn't even going to make it to kindergarten. She's just, and when I met her, gray, dark circles under her eyes, sallow skin, really didn't want to interact with me, sat on her mom's lap the whole time. And of course, I'm biting my fingernails, like she's got so many IgE mediated responses that I'm convinced like whatever I prescribe, she's going to have an allergic reaction to it. And generate, again, this sort of life-threatening. She was regularly hospitalized with IV prednisone for this respiratory response. So I was really ultra careful with her. I think there's a place, often a lot of us clinicians will use clinical presentation and may go off of that before we order a lot of expensive testing. That's certainly how I practiced. But with this little girl, I didn't want to take any chances and prescribe something unless she absolutely needed it. So we did quite a bit of testing. One of those tests was a comprehensive digestive stool analysis test. And I did that through Genova at the time. And she came back with dysbiosis. So she had overgrowth of a number of different bacteria and candida. And then she was underrepresented, I guess, or she didn't have enough of the beneficials of bifidobacterium. So I asked the clinician or the lab, the person at the lab, the customer service at the lab, if they had a recommendation for pediatric dysbiosis. I had never treated pediatric dysbiosis, and I actually hadn't treated much dysbiosis at all in my practice at that point, which is I'm so grateful to have found out the importance of that at this point, But she said, try biocidin. And so I ordered a bottle of biocidin, it's a liquid. And I gave it to this little girl, 1 drop twice a day to start, or 1 drop 3 times a day. So it was based on her weight. She was about 30 pounds, very underweight little girl. And then I crossed my fingers and sent her home, right? So we prescribed that, and she came back in 3 weeks. And honestly, she was like a different kid. So pink skin, just vibrant, just excited, happy, vibrant, and she hadn't had a single respiratory event since we'd seen her last time, and she was having them weekly before. And for years after that, she actually didn't have another respiratory event unless she got an exposure to a known allergen. So it was just a really remarkable experience. And it's why we go into practice, right? As clinicians, when we get to see the quality of life, not just hers, but her whole family's quality of life really changed in that moment. And her mother actually credits Bio-Botanical with her being alive today, which is a really cool thing, right? So that caught my attention, and then I was off to the races, testing it on myself, my family, and then in my clinical practice. And it was such a remarkable thing once you learn the mechanisms of action of this product and the importance of the microbiome and how it affects all these different areas of the body, then the application becomes much broader and you start using the product. And for me anyway, when I started using the product, I became very excited about sharing this information with other practitioners. And so at some point, after meeting Rachel and working conferences and doing occasional speaking for her, they offered me the position of Director of Education last year, and I gladly accepted it. So it's a long story, but I think it relates really well to what we're talking about today, which is the effect of the microbiome on the lungs. And for her, it was actually a life-threatening effect that she had from her microbiome. I've since found out she also had mold exposure and tick-borne illnesses on top of all of that. And so she had a whole lot going on in that tiny little body of hers. But the cool thing is that Bio-Botanical was the perfect therapeutic for her. So a remarkable experience for me.
Yeah, it's a remarkable product. It's one, in my work with the pediatric population, I use very often. It is so broadly applicable, so effective. And, that story illustrates, people often think, well, what is one drop, 2 or 3
Right.
times a day going to do? And it's like, it's a pretty amazing, pretty potent thing. So I'm excited to delve into this. That gives us sort of a case study right out of the gate of how you apply this, which is awesome, because in our clinical grand rounds, we like to use case studies. We like to help our practitioners understand, the applications of these products and of these protocols. So that's awesome. Let's get into what the gut-lung axis is, how the microbiome impacts that. I'm going to go ahead and turn the hosting over to you, because I know that you have some great slides to share with us here. So I want to make sure that you can share those.
It looks good. I'm gonna, before I share, I'm just gonna do a little synopsis on respiratory health, where we're at in this country right now and worldwide. Of course, the reason that I got interested in evaluating their respiratory health and the microbiome from a literature standpoint is because of where we're at in the world right now and the relevance of respiratory health currently. But respiratory conditions, chronic and acute, are some of the most common issues that we see in clinical practice. And so some of those are COPD, that's 3 million deaths worldwide per year. And asthma, of course, I think is one that we see more often, probably in clinical practice, or at least I did. What's interesting about asthma is that it can, if you have asthma in childhood, it can impair your airway development and persist into adulthood. And then children and adults that have asthma have impaired innate antiviral immunity. So directly important right now with and seasonal wellness in general, right? Upper respiratory infections of any kind. And what happens with them is an altered cytokine response. So they're more likely to get this sort of rampant cytokine runaway response that causes damage to the tissue. And it was really, I listened to Kieran speak last week, and he was talking specifically about sort of the cause of that. And it really so beautifully, again, dovetailed with what we're talking about today, which is that if you have chronic inflammation through your whole body, then the signals that the microbiome and your body sends to your immune system actually can't be detected, right? And so that plays into this as well. When you have this chronic inflammatory response in the lungs, then it can't detect when we're sending out the help signals, when our body is looking for assistance there from the immune system. And by the time the immune system gets to it, it's just, it's a huge response. And then we have damaged pulmonary tissue and all of that. So that was really interesting to see that brought in as well. So a lot of these also have comorbid conditions. Those are diabetes, osteoporosis, metabolic syndrome, cardiovascular disease, and mental illnesses. All of those also have a comorbidity often with asthma, which is fascinating. Just again, that sort of broad systemic effect that we see from, I think probably microbiome may be a common link there.
Yeah, and I think the research literature bears that out, right? As we get more research, we're finding more and more of those connections. It's very common in my practice to see kids come in, they're here for, mental health or neurological kinds of concerns. And then it's like, oh, and they have asthma. Oh, and they have allergies. And parents go, well, what does that have to do with it? And it's that connection. And the research is bearing out more and more that microbiome connection to all of that, right?
Yeah, and thank goodness we get to think that way as clinicians more globally for the patient, so that we don't have to splice out, is it they have a lung illness and then they have a GI illness and then they have a neurological condition and we're sending them to multiple specialists. It's so rewarding as a practitioner to be able to identify and treat at the root cause and then watch all of those things improve at the same time. It's just I always felt like it's such a gift for me as a naturopathic doctor, not to have to follow sort of a standard of care and to be able to use my own critical thinking skills with the patient and be able to hopefully bring to them some ideas that will help them solve, right down at the root. That's what we're after, right? With this stuff.
Beautifully put, for sure.
So there's accumulating evidence right now of the influence of the gut microbiome, just the gut microbiome on lung immunity, and that happens through the gut-lung axis. So I think most of us have heard of the gut-brain axis, the gut-skin axis. So there's also a gut-lung axis, and that's important because right now, of course, it's important in the world based on what we're dealing with in terms of the pandemic, but also just in general. One really fascinating thing is that 100% of lung diseases have an altered pulmonary microbiome. So when I was in school, we didn't even learn that there was a pulmonary microbiome. Actually, when I was in school, we never even talked about dysbiosis. So it's pretty amazing, right? How far this has come, our understanding of the importance of the microbiome in the last 20 years or so. So I'm going to see if I can find the right, share the right stuff here. Let's see. Will you let me know if that works?
Mm-hmm.
Can you see my slide? Okay. So this is just a research article showing that there's regulation of lung immunity that happens, that starts in the gastrointestinal tract. And there are a number of ways that happens. And this is what I find fascinating. Like I love listening to Kieran speak about the vagus nerve and the dorsal vagal complex, because that plays a role here too, which is fascinating, right? So for people, I'll actually look at my notes for it because it's so beautifully put in the article that I don't want to take away from it. So I'll get to it in just a minute. But the intestinal microbiome affects systemic immunity in these ways, right? So regulation of T cells, so T helper cells, T regulatory cells, and that's really important because we want enough gas and we want enough breaks, right? So we want appropriate immune behavior. And if your T regulatory response is off, then you can either be suppressed and not actively fight off pathogens, or you can be activated and you can get this hyper-inflammatory response that then causes damage to the pulmonary tissue. Oral tolerance, and so this is important because it helps us avoid excessive sensitivities to foods and to environmental antigens. Production of short-chain fatty acids, so we know like things like butyrate and propionate and acetate, those are all really important for systemic anti-inflammatory effect. So again, to keep that inflammatory load down so that when the body is trying to signal, that the immune system can hear it. And the microbiome actually signals too, which is a fascinating thing I just learned. So weird. And then again, regulation of systemic inflammation through all of those means, and more probably that we haven't elucidated yet. Alterations in the pulmonary microbiome, or in the GI microbiome, GI tract, and how it affects the pulmonary immunology are included in allergies and asthma and influenza and other infectious diseases, immune priming and shaping. So a lot of this looks like what we just looked at, but gut-derived sepsis and ARDS or SIRS. So this is important because I just want to clarify here that this particular research article was not talking about the sort of runaway inflammation, pulmonary inflammation that we're seeing right now. This was actually talking about if someone has a ruptured appendix or a ruptured, some part of their intestinal lining ruptures, then that can cause, actually people can go into pulmonary failure as a result of that, which is just a fascinating thing, right? Just to think about it in that way. But I think it does make a really clear link between the two of them. COPD also has altered GI tract, often will have altered GI microbiota. I'm going to skip that one just because I want to talk about other stuff instead. So normal adults are constantly contaminating their lower respiratory tract with bacteria. However, infection only develops when normal pulmonary defense mechanisms are either impaired or overwhelmed by the aspirated bacteria, and the aspirated bacteria can rapidly multiply. So basically what this is saying is that if we have adequate pulmonary immune response, if we have appropriate pulmonary immune response, then we won't succumb to lower respiratory infection. That's pneumonia, right? So, and COPD, I think of that as well, but or can be related to it. And the other piece of evidence on where the gut and the lung is concerned is that 70% of people with, I think this is COPD, let's see, severe lung diseases of any kind have gastroesophageal reflux. Mm-hmm. So interesting, right? And so, I mean, I think in a way, as we think anatomically, like it makes sense, you might reflux some of those, the microorganisms from the gastrointestinal tract, and that they are likely pathological if the person has a reflux, that they can reflux it potentially, and we could get microaspiration into the lungs. Maybe that's the route, or maybe it's just a symptom of a gastrointestinal tract that's out of balance, and they're not able to mount the same immune response. They didn't talk about the mechanism of action here. But here are all the diseases that are associated with an altered pulmonary microbiome. So, I mean, it's pretty fascinating, right? This is pretty much everything that we'll see in terms of respiratory disease in our practice. So really fascinating information. So the other piece that I think is really interesting, actually I'm gonna stop share for a second and just kind of go back to a conversation about a few other things that I don't have slides on, but that I want to make sure that I share with everybody, is that, so and some of this we already talked about, that, but the immune cells in the lungs, this is what's so fascinating to me, to go a little bit deeper on the actual immunology of how the gut and the lung access their interaction. So when we have a presentation of any antigen, the dendritic cells on the surface of the gastrointestinal tract will pull those antigens in, and they get sequestered in the lymphatics in that area. They don't go out systemically, and that makes sense, right? Because we don't want to be reacting to everything. This is part of that tolerance piece. But what does happen is if we get exposure to virus or bacteria in our respiratory tract, whether it's sinuses or oropharynx, we swallow it, and then those dendritic cells will identify those little viruses, right, or whatever it is that bacteria, pulls them in. Our immune system starts to sort of interact with it in the lymphatics, and it starts to build a little army. And the army will sit there, and it doesn't do anything until it's signaled from somewhere else in the body. And then if it's signaled, so in the pulmonary, immunological cells in the pulmonary, or in the lungs, I'll just say it that way, the lungs, those cells will signal to the primed cells in the gastrointestinal tract and those mesenteric lymph nodes. And then all of that artillery, that army, comes directly to the lungs after being primed in the gut. So if we don't have healthy healthy mucosal function in the gastrointestinal tract, we will lose some of that effect and our ability to manage pathogens when we do get an infection in the lungs. So just really interesting. That's the sort of the deep or down and dirty immunology on it. I just thought that was so interesting. It's such a beautiful design, and I think for me as a naturopathic doctor, I just find it's so marvelous what our bodies are capable of, and the deeper that we learn about the physiology that our bodies consistently perform, that it's just amazing. We come into the contact with these viruses and bacteria all day, every day. Not as much now as we used to, I'm sure, but it's an important part of the development of the immune system, and it's an important part of keeping us healthy, and our bodies know what to do if we keep them in good working order. So it's just, I just love that. And again, I said to you before we went on, like, it's just an amazing thing to watch and to be able to see and find. And now in the medical literature, the reasons why I saw happen what I did clinically when we did certain things, right, or for our patients or with our patients. So this would explain some of that. It's a really long sort of diatribe, but it was so fascinating to me.
But I think that explanation is really important because, you know, it's becoming more mainstream to hear, oh, the majority of our immune system is in our gut. Oh, the connection between the gut microbiome and our immune system. But we're not always really aware of how that actually works, right? And so what you just laid out there is like that, okay, when we say that immune health is so connected to gut health, here's a mechanism of action of why that's the case, particularly as it, you know, pertains to respiratory issues. And that's really important to understand, that there's all of these components working that make the gut so key in our immune function.
Yeah, it's so true. And I know, I mean, I remember sitting in medical school and in gastroenterology, the teacher saying it's all in the gut. And I'm like, come on now.
Right.
We have a lung, we have brains, we have lungs and we have a brain. I said that backwards. We have a heart. Like, why is it all in the gut? And I truly don't think I understood that until I was able to watch it bear itself out clinically. And I wish I'd surrendered sooner, but I didn't. So here we are. And now I'm like, you know, the same. I'll say the same exact thing, right? It's all in the gut. Right. Make sure you have a healthy gut balance. So just that, I just found that really cool. And so the gut and the lung, this is the other piece I was going to talk about earlier that I want to mention too, is that the vagus nerve is involved with some of this too. So I know that I'm sure your listeners are all really well versed because of all of Karan's amazing information about the dorsal vagal complex. But when we have healthy gut, then that support, then we keep LPS where it's supposed to be. We prevent any kind of chronic inflammatory condition, any damage to the blood-brain barrier, and the vagus nerve that could potentially affect. We think about it have thought about it for SIBO primarily, right, for the migrating motor complex and motility. But it turns out the vagus nerve is also sends healthy signals, and that prevents shock-induced organ injury, including in the lungs, and prevents the gut barrier from getting damaged in acute injury, like if you have an acute infection. So if your vagus nerve is interrupted, this is just another reason, keep that LPS down, to keep the microbiome healthy in the gut, is that if your vagus nerve is awry, it's another hit against your ability to manage shock-induced injury, which is what we're seeing right now, sort of globally. I have to be really careful what I say, right? You know? And I would like to just say real quickly that I'm here as a representative of Bio-Botanical Research, but speaking as a clinician, I'm hoping to share some information with everyone, and that if I do talk about using the products in a particular way in my clinical practice, it's not a claim by the company at all, and it's not a substitute for medical advice. So just making sure that you take that where you need to your practitioner. If you are a practitioner, just making sure that you understand that we haven't done any research specifically on the gut-lung axis, although we're working on some of that stuff right now. So anyway, so I think most of the stuff I've talked about that are in my notes at this point, that beneficial microorganisms, again, also reduce systemic inflammation. One other piece that I'd really like to talk about is the fact that the microbiome that's most closely associated to the lung microbiome is actually the oral microbiome. Yeah. When you say it, I'm like, oh, well, makes sense, right? Because it's right here. You know, it's closely anatomically related. But the mechanism right now, the proposed mechanism, is that when we sleep at night, we lay down, we go to sleep, our reflexes are suppressed when we're sleeping, and we'll get microaspiration. So we breathe in a little bit of our saliva, and that's actually healthy, right? So what we don't want is it coming back up from the gastrointestinal tract. But if you have a healthy oral microbiome, then this is a healthy thing, that you populate the lungs with beneficial microorganisms at night while you're sleeping. It does make me want to brush my teeth right before I go to bed at night, I will say that. But it's also, and I know there's a lot of conversation about the importance of the oral microbiome as it relates to the gastrointestinal microbiome. There's research showing people who brush their teeth after every meal have a lower level of candida or yeast in their stool than people who don't, which is basically proof positive, right? That what's here ends up there. And I think we swallow a liter of saliva a day, and there's 10 to the 8th microorganisms in a milliliter of saliva. So think about the importance of making sure that we have health there. And that's something that I wasn't aware of when I was in my clinical practice. It's really a newer information for me. But 70%, over 70% of the adult population in the US has periodontal disease, which is caused by plaque and by harmful microorganisms in the mouth, or overgrowth imbalances in the mouth. And so making sure that we address that as a source of LPS, as a source of inoculation into the gastrointestinal tract, also very important. And it does explain to me sort of retroactively why I had certain patients where I maybe didn't work. And especially if we use the capsules instead of the liquid, we skip this whole microbiome. So making sure, and it's one of the great things about Biocidin liquid, right, is that you're also getting treatment here. We're working this microbiome, the esophagus, the stomach, the gut, all of that. So
well, and it's really interesting that you bring that up, and I'm glad that you wove that in, because last month for clinical grand rounds, or in September, we had our guest was Dr. Al Dannenberg, who is a periodontist and a functional medicine specialist. And that entire clinical grand rounds was all about the oral microbiome and connection to gut health. So exactly, it ties in with what you're saying. So what I would say to all of our practitioners listening, if you didn't catch Dr. Al's clinical grand round session back in September, go back and check that out, because that really dovetails nicely with Dr. Strand, what you're talking about here.
It's really fun to watch the research come out too from this company. And I would say this is related to that, because one of the question we get the most at the company from practitioners is what about the beneficial microorganisms? What happens to those, right? So Biocidin is 17 herbs and essential oils. It has I think of 3 main mechanisms of action, and I like to share this with clinicians so that they understand why it works the way it does, right? So one is antimicrobial. So it's antibacterial, antifungal, antiviral, all of those things. And we have research on all of those things, which is exciting. And then it's also immunomodulatory. So that's our human clinical trial showing an upregulation of IgA. Super important, obviously, right now as well. That's the Biocidin throat spray that's on. And I think we're launching a baby together, right? That contains that product, right? Yes. So that can have the spores. Megacidin, yeah. And so that's exciting. I'm really excited to see how that product. I can't wait to get my hands on it myself. And so that is so immunomodulatory. So the cool thing about, I think, the grace of herbs, right, is that it doesn't do a unilateral push the way that some stronger therapeutics might. And so I think, you end up getting an adaptogenic effect more, where you're seeing the herbs work alongside the physiology. So we do have reports of elevated IgA. And I think the mechanism there is probably like people have an overgrowth of pathogens, and the Biocidin helps to lower that load. And so the immune system is able to sort of relax and not produce as much IgA. But we also have this in suppressed individuals increase in IgA. And I love that. It also feels like that first do no harm part for your patient, right? Like here it is, we have a product it's not going to initiate, I guess that we haven't, what I would say is it's unlikely to initiate any kind of immune problems, autoimmune. It's unlikely to suppress. It's just it really works alongside. So that's the third mechanism of action then is breaking down biofilms. Which is a really important part as well. Like I think of plaque, oral plaque as a biofilm. That's the easiest biofilm for people to identify, right? It's the fuzz that we have on our teeth if we don't brush our teeth, or if we eat too much sugar, then we'll get, sort of rampant growth of the fuzzy teeth. And that's usually due, the main players there are Candida and Streptococcus mutans. So that's where the development of our oral products have come from, really a need to direct some therapeutics there.
Absolutely. I want to make sure that you talk about the different products. You've mentioned the capsules, you mentioned the liquid. For our viewers, our practitioner audience who is not as familiar with the product, you talked about the basic formula for it. I just want to make sure that you have a chance to touch on, we've got the spray, talk about the options there.
Okay, is it okay if I share the screen right now just so that people can see?
You still have control of it. I won't take it back till the very end, so you can tell whatever you want.
Okay, perfect. So the Biocidin itself is the flagship product right here. That's the liquid. It's 17 herbs and essential oils. Again, the 3 mechanisms of action are the antimicrobial, biofilm busting, and immune modulating. Okay, so there are probably other activities that we haven't documented yet, but those are the ones we know about. So once you learn that activity, you can see here that 6 of our 10 product line contain Biocidin. And so at that point, you select your product based on what part of the body you're trying to get to. As far as I know, we have the only broad spectrum antimicrobial that's a liposome, right? And so that's this product here. And so we're talking about gut-lung axis today. So I primarily focused on the liquid, which is our gut product. But the liposomal, just so that clinicians know out there, that is an amazing product for microbial imbalances outside of the gastrointestinal tract. And so we're thinking inner ear, or excuse me, middle ear. I think bladder, kidney, prostate, skin, all of that stuff, that would be a more well-suited product for that reason. The throat spray, this is the one here that has a clinical trial showing 66% increase in IgA. That is 40% Biocidin liquid and 60% alcohol. And then we have Biocidin in a capsule. I tend to not really prescribe that because I'm trying to treat the mouth too. I don't want to skip the mouth. And then like you, I worked a lot with pediatric patients, and I think being able to titrate the dosing to find the right amount, it's so lovely to be able to figure that out. And it tastes. Have you tasted it, Dr. Berkins?
Oh yes. Oh, I've used Biocidin for years. Absolutely.
Okay. I always describe it as sweet pizza. It doesn't. It's not bad. I think the garlic and the oregano sort of come through. So,
and then we really have kids who fight about it. They get used to it pretty quickly, and it is possible to. If kids really aren't getting used to it, you can put it in some things too, but really I've not found that it's difficult for kids to adjust to it. And as you said, that the titration is really nice. That's what I like with the liquid, either for young kids or even for just even adults with more sensitive systems, to be able to really carefully titrate that to give them the benefit without overdoing it or, taxing their system.
Yeah. And it is, clinically, I'm going based on what you just said. I think, when we have those really sensitive patients, it is because you're breaking open biofilms also with this product. Those biofilms are going to be housing microorganisms that weren't even exposed to the immune system before, oxalates, LPS, heavy metals, all in those biofilms. And so when you break open those biofilms, for me, when I first started using the product, I thought, man, half my patients react to this, but they were actually having sort of like a healing crisis that I wasn't adequately supporting. And I've since learned, right, that people need to use this. So the GI detox, that's a good segue into the GI detox, which is the binder here. Just like the Biocidin is a broad acting formula, many different things in it. The GI detox is the same way. It's activated charcoal, silica, zeolite clay, humic and fulvic acid, apple pectin, aloe. So it has some nice healing support as well to help to hopefully prevent the constipation that often comes along with binders as well. But this does a good job of mopping up sort of the shrapnel that comes with breaking open biofilms and the antimicrobial effect. It can really get people through that sort of ramping up and help with compliance as well. And so then our oral products are these two. So there's an oral rinse that has the liposomal Biocidin in it, and the toothpaste. Toothpaste is a great place to start with patients. Here's the thing that I love about toothpaste is everybody's already brushing their teeth. So this doesn't add to their supplement load. People don't resist it. It's an easy way to start to modify the oral microbiome, and then by proxy, the gastrointestinal microbiome if you want to start there. But it's just a really nice product. We do have pilot research on those. How are we doing on time? I don't want to run you out of time, but
we've got about 8 minutes, so we're good.
Okay. Well, let me show you a little bit of our oral research since we've talked about the importance of the two. Let me go this way over here. You guys are going to watch me in action here, in all of my technological glory. Let's see if I can find it. Here's a pretty interesting slide. Let's go to this one. This is biofilm on a toothbrush bristle.
Oh, yikes.
I know, isn't that awful?
I have
And
some
this is,
patients who I need to show that to. Some of my friends I work with who aren't so into brushing the teeth. I think this image would be a great one for them to see.
well, I will happily share it with you, Dr. Perkins, if you'd like to have it.
Too.
So the other thing to think about with the mouth in general is that the teeth are our only non-shedding surface in the body, right? So our mucosa in the mouth, the oropharynx, the gut, we can definitely get biofilms there and in the lungs, but it's not as easy for microorganisms to establish themselves there because the epithelium is constantly shedding itself. So here on the teeth, they end on implants. So this is why biofilms are an issue, like with knee replacements and catheters and that sort of thing. But this is why it's important to address it right in part. So a little gross. And then I'm going to go to our slide on, I don't want to keep you guys all afternoon here, but let me go to the slide on the oral. There it is. Okay, so I love this slide for a number of reasons. This research was done on an infected root canal, scraping of the tissue and the bone and the surrounding area. So the DNA analysis, and then the practitioner had them use LSF biocidin for 4 weeks, rinsing and spitting twice a day. And the average microorganism load went from 35 pathogens down to 3. And what's cool about this is in this list, you can see Prevotella, that's carrying high risk for people right now.
Yep.
And also Prevotella porphyromonas, both related cardiovascular disease. We see HPV in here and CMV. So there are a couple of chronic viral conditions going on here. Campylobacter, we know closely related to acute food poisoning, it is a gram-negative bacteria and releases that CDTB that Dr. Pimentel talks about that can potentially irritate our immune system. There's amoeba in here. There are all sorts of microorganisms, and you see how broad acting the product is when you look at something like this. So very exciting pilot research for us. We're initiating a small clinical trial right now with Barbara Tritz and one other dentist who I'm forgetting her name right now. I've heard it just one time, so my apologies for that. But we're going to do some clinical research on pocket probing deaths and periodontitis as well, using this product, which is that oral rinse. And the oral rinse so we have the toothpaste that has 20% of that is biocidin liquid. And then the dentalcidin LS is a liposomal. So you'll get deeper activity then into the periodontal pockets. I think of like cavitation root canal, that sort of thing with the oral rinse. So yeah, that's that's it in a nutshell. That's where
I want to comment on the spray, because the spray is really unique, and that really, the product that our companies are working on together, the megacidin, is that spray biocidin with the spores in it. But as we're talking about this gut lung axis, as we're talking about the oral microbiome and the connection to the immune system and the lungs, all of this interconnectedness, the spray is really interesting, along with the liquid as well, because we really are hitting the oral immune system, the factors of that affect immunity that already start in the mouth, and then getting that down into other areas of the body, into the gut, impacting the lung microbiome. So it really is, the delivery mechanism of that really makes sense when we're thinking about immunity, right?
It sure does. Yeah, if you think about, so we know that that IgA is supported by it, will be supported by that product as well. And then I think we also, all the spores have that same level of activity for immune support, right? And so just very cool. And then combine that with the antimicrobial effect. It just, to me, it feels like what I'm going to keep in my back pocket.
Yeah, absolutely. And one of the things I love about your company, about Bio-Botanical, you have some really lovely charts and things that are very helpful to practitioners for understanding how to use the products in different types of situations too. Like, are we being proactive? Are we, at a moderate level? Are we now deep in the throes of treating something that's pretty chronic? You have a number of resources that really guide clinicians with that. And so I just want to point that out for our, practitioner family who's watching here. You do a really lovely job of supporting practitioners and understanding how and when and why, to layer these products in.
It's why it's part of a main reason why I love working for the company is, as a scientist myself, I want science, and I want research, and it's really just awesome that Dr. Fresco is willing to put money into understanding and identifying why the product is doing what it's doing. I forgot to mention one thing, if I could, real quickly. We are working with Sun Genomics right now that does full genome sequencing. And I think I said this, maybe I didn't, but the main question that we get when we are at conferences and from practitioners is, what about the beneficial microorganisms? Right. Is there any chance you'd let me share again for just a second?
I took it back too soon. Hang on. Yep, absolutely. You can share it. There, we should be good now.
Okay, perfect. So let's see. Share, if I can only manage to make it work. There we go. Can you see that?
Sure can.
Okay, so this is super exciting research for our company. This is a pilot study. We're looking at going into deeper research with Raja Sivamani at Pacific Skin Institute to bear this out in such a way that we could potentially publish it ourselves, or he will publish it, not us, obviously, but it's very exciting for us because the question we get most often is, what about the good guys? What about the beneficial microorganisms? Does biocidin wipe it out? And all I've been able to say is it doesn't appear to be the case clinically. You don't see the same side effects from biocidin that you might from a pharmaceutical that wipes out the microbiome. Or sort of that unilateral wipeout of certain kind of microorganism. So we decided to look at that and to study it. And this is our preliminary data on that. So I think each color here is a person. So this is 7 people. Mm-hmm. Here are a list of probiotic organisms and their abundance. So we have Akkermansia on that list, Oxalobacter, a bunch of Bifido and Lactobacillus, Saccharomyces as well. And what we're looking at is the total abundance. So what we can say based on this is that in no circumstances were the beneficials wiped out by biocidin. But what we didn't expect was that Akkermansia actually increased in 6 of these 7 people.
Wow.
So Akkermansia, you and I both know, right? Super important microorganism that you cannot put into a probiotic. So this is just like further fodder for why our company works so well alongside of your company. Like they have a similar effect possibly. Like I can't make a claim on this yet, but it's very exciting for us to see this almost across the board, this increase in Akkermansia and that metagenomic richness then that could come from that. And just very, very cool data. And most of these people, the total probiotic abundance went up. So not just Akkermansia, but you can see here 0.4 to 0.52, 0.14 to 0.31. This one went down a little bit. Everybody, look at this one from 3.3 to 13%. All they were doing is biocidin and GI detox. So you can see everybody else increased their beneficials. So we don't really understand the mechanism in that. It could be that you're lowering maybe the pathogens or the harmful organisms, and so the place fillers are these beneficials. We don't know if it's that or if there's some prebiotic effect from the biocidin, but we're hoping someday we'll elucidate that. But we're just happy for now to have some research showing that.
Well, and I think one of the things that works so well with your company and Microbiome Labs, and especially their work together, is both companies are so committed to the research. Not just putting out products and saying, well, they seem to work, that's great, but really reinvesting a significant amount into looking at why do we seem to be getting these results? How can we make that better? Really having the research substantiation for that, which is so important.
It is.
So I'm glad you had a chance to share about that, because that's great, and probably a question that was in the minds of some of our listeners as well. So as we wrap up here, you shared a lot of really fascinating information about the gut-lung axis and all of those things. what's one clinical pearl or piece of wisdom or thing that you would want to make sure that our practitioners walk away from this session with?
I would just encourage all clinicians to get really comfortable with their own, whatever product you decide to use with treating or finding a way to help people balance their microbiome. Because you will never turn back once you start to do that. And watching, take the time, if you aren't already really grounded and comfortable in some great dysbiosis treatments or microbiome balancing treatments. I mean, I use right now, I'm using the Mega Mucosa and Mega Pre alongside. You know what I did is I gave myself Shigella doing a juice cleanse. So I'm all on board right now.
With your own case study.
Yes, exactly. So I'm using those products, and it makes such a huge difference. And we feel fulfilled, and we want to continue doing our work when we see people's health change. And it takes getting really grounded into treating the microbiome before I ever got there as a clinician. Of course, I would see people improve with other therapies and for other things, but so often it comes back to that I would encourage you. And of course, I'm biased and I work for the company, but the reason I work for the company is that I watched it work clinically. The LSF, I'll do one more. I mean, as far as a pearl is concerned, this is the product that if I could have everybody in America have one product in their first aid kit or in their medicine cabinet, this would be it, because it's so good for acute infectious stuff. This, again, not a claim by the company. We haven't studied any of that, but this is just my own experience with it, with like watching it work on acute tick-borne stuff here where I'm in northern Minnesota, on middle ear stuff, and like I said, bladder, prostate. I mean, I've watched this do its work in almost a magical way, and so I would encourage you all to give it a shot carefully after you educate yourself on how to use the product, because you will herx, or you will create die-off for yourself or your patients if you just go after it. So we do have free clinical trainings as well on the product. So whether you order from from a distributor or directly from us, we will provide you with free clinical training so that you can get comfortable with the product use if you would like to do that. So just contact our customer service and they'll hook you up with a free clinical training. And it's nice because it's tailored to whatever you need, whatever you're seeing in your practice. So.
And it's a wonderful opportunity to, as you said, get things tailored, ask the questions that you have that are relevant to your patient population. So I highly encourage people to do that. And we'll make sure that the contact information for those things is available with the session. So Dr. Strand, thank you so much for taking the time to be here with us, for sharing this information. It's important all of the time, but particularly with what we're still, dealing with pandemic-wise now. And the more that we can learn and understand about immune function, about the connection of the gut to that, and certainly what you shared on the lung-gut axis, really, really pertinent, especially right now. So thank you so much.
Thank you so much for having me and for giving us a platform to share the information. I really appreciate it.
Absolutely. Our pleasure. And thanks to all of you for being here with us and watching. We will see you back here next month.